Position 5 minutes. Everyone else 2 minutes. This is House Bill 402.
Here's one for you, one for me.
I believe we've done everything else.
Thank you, members. I'm bringing you House Bill 402, which is a bill that looks at a survey that we do in our schools already and just extending the opportunity for additional questions to be asked. The CDC every 2 years does a survey of school districts to look at the risk behaviors that students take. Louisiana takes the students take the youth risk assessment survey from CDC, but there are certain questions that are not asked on it. We are one of 2 states in this entire country that do not allow the sexual risk behavior questions to be asked of our students. We've used this risk assessment to deal with kids who are dealing with drugs because of their behaviors, alcohol because of their behaviors, riding a bicycle and we've passed legislation for helmets and motorcycles. We've used this risk assessment for students who have diabetes and asthma in order to come up with good policy in order for us to be able to deal with these kinds of things that students take risk on. But yet, because Louisiana does not ask these questions, we've not been able to come up with good policy in dealing with the issues that you have in front of you. Louisiana ranks second in the country in chlamydia. Is that what I'm right? First in the United States for primary and secondary syphilis between the kids between ages of 15 and 19. Second for chlamydia. Second for gonorrhea. Second for HIV amongst youngsters, 13 to 19. And when children don't have the right information and that there are no policies passed to provide them with the right information, then I can assure you that the risks are being taken. And they're taking those risks because I don't know if you have the other one, but in many of your parishes, the birth rates for students aged 15 to 19 is also, Louisiana ranks, they're 35.5% of students who have babies, pregnant teens, and we know that the #1 dropout for young girls is pregnancy. The #1 dropout for them is pregnancy. So we're asking that we allow the state to do the survey and ask all the questions that are on the survey.
Thank you, Representative Smith. We have in support Julie Schwam-Harris and Claire Stagg, who both wish to speak.
Okay, Marcia.
So, good afternoon. Yeah, this is Marcia Broussard. I'm with the Louisiana Public Health Institute. And I wanted to just, I asked the representative, would it be okay to share some of the documents that we produce in association with the Department of Health and Hospitals and Department of Education, I believe, as well, our partners. This is one of the services that LPHI does in order to inform schools, to inform community-based organizations, universities, who's ever interested in providing services and in competing for grants or looking for evaluation information or just data as it relates to risk behaviors. This is a standard report. It was initiated by the Centers for Disease Control in 1991. It's used across the country. And as the representative has said, that we have taken in Louisiana, we've decided or made the decision to not include the sexual risk behavior questions. And those questions are also really important in terms of trying to provide programs, trying to conduct evaluations, and also in terms of being eligible for funding that is available to address unplanned pregnancy and high HIV rates and STI rates, which for Louisiana are extraordinarily high. So I just wanted to make sure that you could see that the way that these results are reported is on a state level. It's not on a school level. Anonymous. When young people take the survey, it's anonymous. And what the bill that we are presenting or that the representative is presenting is also complies with the opt-in provisions that are required under Act 837. So I hope that all of the opposition that you might have is addressed in how this is being presented, and that you will support the needs that we have for good information.
Thank you, Ms. Broussard.
You're welcome.
Yes, I'm Julie Schwam-Harris, and I'm from New Orleans. I'm a volunteer advocate with a coalition of organizations called the Legislative Agenda for Women, and we advocate on issues related to women and families, and in this case, young people. Although I want to point out a couple of concepts because we've had some questions over time, besides the fact that this is anonymous and it's totally voluntary. I mean, it's voluntary at all levels. It's voluntary at the level not only of a student who, when they read the survey, one of the first things they encounter is the right to not take it. If they're uncomfortable, even if a parent has opted in for them, if they're uncomfortable, they don't have to take it. It's voluntary at the part of the school itself. The schools do not have to participate in the YRBS. When they're asked to participate, they can, and many of them may want to because they may want to participate in providing this kind of public health data that is absolutely essential across the board in providing good analysis of what problems are and then trying to figure out how we're going to deal with them. But it's also voluntary at the district level. So at all levels of, and the parent level, it's an opt-in because of the laws that do exist in the state of Louisiana, really strong laws to protect the rights and the privacy of parents and of students and systems. It's high school students. These are not young students. Now, we know that some of these problems, the health outcomes that we've talked about, do affect younger students as well, but this survey is only done at the high school level here in Louisiana. And it's aggregated, as she said, at the state level. It doesn't reflect at all on any individual school, on any individual class or student, on any individual district, that it's just swooped up and collected as an aggregate, and this data is used across the country. It's even quoted in things that are not exactly related to what a local school might need, but it's in what the state may be going for in grants. And the other thing I want to just talk about the difference between the outcomes and what this data is on behavior. We have a lot of information. Someone pointed out, well, look at all the information you have. Look at all the information that the state representative quoted on outcomes, the bad outcomes. But what this does is it gives you information in Louisiana on your students. And we may be doing some things well compared to other states. We may be doing some things not so well. There's no way for us to know when you see columns of states and Louisiana is just not there for those questions. So I'm happy to answer any other questions, but just want to make those points. Thank you.
Thank you. Representative Edmonds for a question.
I thought Representative Smith was trying to.
Yeah, I just wanted to say one more thing, that to address a statement that I heard was made on the Senate side when the bill went to the Senate side, that students would be embarrassed to take this test. Many of you were not here when we had our dialogue on comprehensive sex ed. And to hear what students tell each other about the risk that they take, and I will tell you, it's horrendous that a student says that if I put a Band-Aid on my belly button and have sex, I'm not going to get pregnant. This was a testimony that if I drink Mountain Dew before and after I have sex, then I won't get pregnant. These students are taking risk, listening to their peers on what they are doing, and they get no direction, no accurate information. At least if we were able to ask these questions and have doctors and nurses help us with dealing with these issues, then we would not be on these bad lists of high STIs and high HIV and high teen pregnancy. I'll take a question.
Representative Edmonds.
Thank you, Madam Chairman. Representative Smith, or those of you at the table, did you bring any samples, or I didn't see anything included of the type of questions that I've seen some in the past that we've objected to or others have objected to? Did we bring samples of what those type of, into the depth of sexual questions would be asked these young people?
I don't have samples of. Do you have samples of the questions with me? Typically, the questions are things around when young people decide to initiate sexual activity, whether or not they've ever had an STD or an STI.
How many times they've had sexual intercourse during a week? How many partners have they encountered?
Right.
Possibly.
Some of those are
And go on and on, right? That's
It's
the
not-
direction it
yeah,
goes?
I'm not sure how many, but I don't think it's an exorbitant number of questions. It's probably
Right, and this exposure, now, and I don't disagree with Representative Smith that you know, our sexual knowledge and all is advanced to super high levels. But this is a statewide bill, public schools, privates, charters across the board. What does this impact?
It impacts public schools right now. The private schools, I don't know if they participate in the survey. I'm not sure. But I think public schools do participate in the survey. But of course, parochial and private schools teach sex ed.
Yeah.
So.
In many states, or would you have a number of states that you could provide that are already doing similar testing, or
Everybody
but us?
Well, two.
42 out of the 50
42.
Do the YRBS, and only 2 of those don't use the sexual health questions.
And so they collect all this massive data on all these sexual questions, and these states would be able to provide data back that this has assisted them, and their STDs are going down, and their teenage pregnancies are going down.
That
You'd
is
see those
true.
rates.
But
you could produce that information.
Well, states produce reports like this, and you can go online, and the Centers for Disease Control has this information compared state by state, aggregated by state. And it's not just sexual risk questions. If you look through this overall report that I brought, and I'd be happy to leave it with you, it's a variety of questions. Again, helmet use, riding without a seatbelt, drug use, and it's not an exorbitant number of sex questions, but it's, there are people from the Centers for Disease Control who decide what are the most important, valuable information that we need in order to make good decisions about educational programs and other prevention programs, and those are the questions that are used.
So in one of the hearings, we were asked about, one of the speakers who spoke actually against the bill quoted something from a YRBS report. They were talking about the fact that across the country, more and more young women are choosing not to have sex in high school, which is a good thing. Everybody would agree. And the thing is, the quote was that women are more and more of these young women choosing to remain virgins, which is based on YRBS data that exists for other states, but not for Louisiana. We don't know if more and more young people are choosing a path that is actually safer for them, less risky for them. We would like to know that, to know if certain things are working, or we would like to see if Louisiana, the statistics would show we have kids taking more risks, not less. We could look at states that they're taking less risks, not more, and say maybe we should be doing something similar. It's data used in a public health analysis to make a decision to actually try to improve the outcomes. We know the outcomes. We've got the health statistics. What we're trying to figure out is what is leading to these bad outcomes that we might be able to intervene and prevent this, like other states that are being more successful. That's how it would be used, but at an aggregate level.
But the control of some of these questions, obviously, it just depends on the state, depends on the person that selects them. And we were talking about questions as it relates to, do you know how to apply a condom? Do you use condoms? All of those questions are possibilities in any of these sexual risk questions, are they not?
These are valid public health questions that if you know that what is happening, then you may be able to try to prevent the wrong thing happening, which is people taking risks and getting these unintended, not just pregnancies, but diseases that can lead to sterility, diseases that will impact their ability to be healthy, to be happy for the rest of their lives. So that's why you would want to know. And again, it would be with parental consent, with the school system having decided to participate on those questions, with the school participating, and with the parent agreeing.
And I just wanted to add, you mentioned condom use, and that's a really good example. Condom use is probably the most effective way to protect yourself from HIV and AIDS. And in our state, we're like the third highest numbers of new cases. And most of the cases are between the ages of like 17 and 20 some years of age. So, you know, we are really affected by the lack of appropriate condom use. So that's something we'd want to know so that we could advise young people to protect themselves.
So you're saying a parent would have their child opt out where they would not be, they could be 1 in 30 girls in the 9th grade, and that would be the only girl that would not take the test, and that's the situation we're going to place the girl in, or the school could opt out, and they're not going to participate in the program even though we passed this as a law. Is that the opt-out principles we're talking about? You
can, yes, indeed, and in fact, it's not every school participates in the YRBS across the board every year. Because it's a random sample of schools of students, so they don't send out hundreds of thousands of these things. It's really random, and it's for those public health purposes, which is why Mississippi, Alabama, and these 40 other states all agree to do it. It also gives you access to, you're not prevented from getting all of the federal money that's out there for preventing, for sexual health education, but there are some grants that you do not have access to because you're not doing an accountability analysis of what is happening in your state to show that what you're intervening with is actually having a good effect. So they do tie some grant funding to being a participant as a state in these surveys that are randomized, they're the questions. I understand what you're saying about the questions. We're talking about sex, and a lot of parents don't want anybody talking to their kids about sex, which is why that parent can say, no, my child and her friend, because I'm gonna go talk to her mother, I'm gonna say, I'm not letting my daughter, don't let your daughter. They may agree that they don't want their daughter doing that. The problem, but other parents expect and want. They expect and want the public health atmosphere of where their child is growing up to be more responsive to their needs and to help prevent things that, as parents, sometimes you're not really empowered to prevent. We've obviously got the problems, we've got the outcomes. We're trying to say, can Louisiana, which is so high in all these bad outcomes, can we try to be a part of where other states are doing these things as part of the process of prevention? It's really all about prevention. And there's no requirement for anybody at any level to do it. It's all what that community, what that school, what that parent, and even what that child. If that child doesn't want to participate, no matter what has been said, they are not forced to. They can opt out.
Well, I mean, that sounds good. I'm going to close. I know we're time-wise. It all sounds good that would be a reality. However, that's not the reality. That children are, peer pressure is overwhelming. Anyway, I also have great concerns about once you go statewide, you're not aware of this is really a parent issue of how they teach their children, when they teach their children, why they teach their children. And I have great concerns over that.
Well,
thank you, Representative Evans. Representative Broadwater.
Thank you, Madam Chairman. Representative Smith, we've debated this previously, and I think the development of this bill has come after several years of debate and several amendments and discussions we've had in the past. And as I appreciate your testimony today, what the intent is behind the bill is that it's consistent with established law that local districts could choose to offer this, and so there is a local option, first of all, correct?
Correct.
Second of all, my appreciation of what your intent is that parents have the ability to opt out, and in fact, in this statute, with regard to established law in terms of offering sex education, that the parent has the ability to opt their child out of sex education. And I think I'm hearing you say it's your intent the parent would have the same opportunity with regard to the survey.
Correct. And of course, we don't offer sex education.
Understood. I guess I'm pointing out the next thing is that under the current law, in talking about sex education, there's a requirement there in terms of it would be offered in an age-appropriate manner, which it sounded like to me from your testimony was what your intent is with this as well.
No, this bill is not dealing with sex ed.
I understand.
It deals with the survey.
But
the
falls
survey
in the
is
same.
only in the high school.
Okay.
Correct.
So,
yeah.
and which leads me to my final point. I understand what your motive is, and that's why last year, once we addressed those other issues, I supported your bill. Here's the one thing I would point out to you. One, the language right now doesn't say high school. It just says students. And I understand your intent is high school. So my suggestion to you would be that maybe on line 4, after survey and before students, you say high school, if that is your intent. The second thing I would point out is, while there is a provision further down in law with regard to the opt-out provision, it specifically references the sex education course. And so if that is your intent, I think what it sounded like it was based on your testimony a while ago, that you include a specific sentence on this part saying that same thing, that opt-out provision is there, so that it's abundantly clear. And then the last thing, you also mentioned that the survey is done anonymously, and we've discussed that in the past. I would also suggest that in order to make sure, while this survey is, there may be future ones that are not. So my suggestion to you would be that you also insert something that says anonymously, which goes to your testimony. I know that's what your intent is. The language doesn't completely say that. And those are things that we addressed last year. This bill's a little different than what last year's was. And so I asked staff if they would prepare those amendments.
The only thing is the CDC only does the survey at high school levels. So to put it in the bill, that's the only
Correct.
place they do do it.
I understand,
Yeah.
but
You want it specifically in the bill? That's fine with me.
well,
I
my
don't know.
point, Representative Smith, is while I understand the CDC does that, what this bill says is that Department of Health and Hospitals or the Department of Education may do that.
Correct.
And so if we did that, here would be my suggestion. One would be on line 4 after survey and before students, you would insert high school. Following on the same line, after the word students, you insert the word anonymously. And then following that we would have a subparagraph C that says, prior to the administration of any survey authorized by the provisions of subparagraph B of this paragraph, a child's parent or legal guardian shall be provided the opportunity to request that he be excused from completing the survey. Upon such request, the child shall neither receive nor be required to complete the survey, which gives you the opt-out provision, which I think is consistent with what your intent is, but it makes it abundantly clear that we're talking about survey.
That's fine.
And so I'd like to offer that amendment at this time, Madam Chair Lady.
Representative Broadwater offers the amendment he just explained. Is there any objection to the amendment? You have a question on the amendment? Okay, Representative Amade has a question on the amendment.
Okay, I don't know whether it's best to address to Representative Broadwater or the ladies at the table, but it's my understanding that when federal dollars are going to be used, that the federal law requires parents to opt in, not opt out. So should this amendment be an opt-in instead of an opt-out, even though we're not talking about federal dollars necessarily in this bill?
There's no opt-in requirement in federal rules with these types of surveys. There is
Under the Protection of Pupil Rights Amendment, it's not included? For
in
programs
federal
that
law?
use federal funding from the U.S. Department of Education?
Not for the YRBS. The YRBS is not an opt-in
Okay.
usually.
I'll just
State,
read the information I was given, and you
State-
obviously know more about it than I
Yeah.
do. The Federal Protection of Pupil Rights Amendment applies to programs which receive funding from the U.S. Department of Education. This amendment to the No Child Left Behind Act requires that schools must obtain written parental consent before minor students can be required to participate in any survey which reveals information on sex behavior and attitudes, among other things. Is that not correct?
I'm not aware of that, although we are going to research it, but my appreciation is that the law that is being discussed would comply with Act 837, which does provide an opt-in requirement. So we didn't, I don't know in terms of the
Representative-
legislation, but I don't think it's in
State
there.
law, but it's not federal.
Yeah, it's a state, yeah.
Representative
I have
Broadwater,
to research the federal.
on the question, he wanted to answer the question.
Well, I think just for the sake of brevity, it sounds like that the author is willing to work on that. The current statute that it's already falling within deals with it from the standpoint of an opt-out. For the time being, though it sounds like the author is willing to try to explore that and figure out what's the best way to approach it. I'm going to offer the amendment as I stated with the opt-out, and go ahead and offer that. I've got a meeting in about 7 minutes, so I apologize, but I'll offer the amendment in that fashion.
Thank you. Representative Broadwater has offered the amendment that he explained. Is there any objection to the amendment? Hearing none, that amendment is adopted. And Representative Broadwater,
I don't have any more questions.
Okay.
And members, just for some pieces of information, I don't know where all of your parishes are, but I can tell you when I look at this issue, East Baton Rouge Parish ranks first in teen births. Second is Jefferson Parish. Third is Caddo. Fourth is Orleans. And I could go on, but under chlamydia, Madison Parish ranks first under chlamydia. Red River, 2. Orleans, 3. Natchitoches, 4. That indicates that there's serious problems even in our smaller areas where children are experimenting with sexual behavior, and we don't know how to deal with it. And these are only reported cases. Kids come to us not even knowing what they have half the time. So we've got to find some way to put a handle on the policies that we put in place. And we do have the governor's office that looks at the Youth Excellence Program that I know that they're making some strides in talking about training. So this would even help them in looking at the training that they put together for information that they receive from this survey.
Hey, we're getting close to the end of time for the proponents, so I want to let Claire Stagg, who also wished to speak in support, go ahead and have her 2 minutes.
Hi, my name is Claire Stagg. I'm a resident of Baton Rouge and a LSU student, and I wanted to come speak in favor of this bill today because while surveying students may seem very controversial to the legislature, it's really not to students. It really couldn't be more clear, actually. We see this as a common sense first step to creating and implementing effective and cost-efficient initiatives aimed at improving our state's honestly very troubling health outcomes. This is especially important for my peers and I as we see the significant shortcomings of our state's healthcare system currently and worry that due to the economic crisis that we're seeing, resources may not be available to us in the future. I think the biggest thing here is that this isn't like extraordinary at all. 42 states take the survey, 2 states don't include sexual risk questions. And to be really honest with you, I don't think that any of my peers would find it invasive, disturbing, any of that to be asked these questions. I think that we have the maturity level and the maturity level needed for this. So I just wanted to come out and ask you guys to support this bill because it really is an important and common sense first step to collecting the data that we need to create effective policy to give our young people and all Louisiana residents the health services they deserve.
Thank you, Ms. Stagg. Thank you for your testimony. Representative Amade for a question.
Thank you, ma'am. I wanted to ask, the surveys that we're talking about, apparently many states are using surveys. I don't know if they're using the same one. I'm assuming that these are already written by the CDC. Yes. So we have completely passed up the opportunity for parental review or parental input on the questions or the makeup of the survey. Is that correct?
Yes, I would say, although I don't know that parents would have the option to review the survey.
But so, not like a line item veto option.
No.
It's all or nothing.
No.
Probably not.
Yeah.
Okay.
Yeah, they've been, and the survey's been done, like I said, for years. They've put these, and they based their questions on information they received back from the states.
Thank you.
Thank you. Representative Hilferty.
Thank you, Madam Chairwoman. To Representative Amade's question, if it is a preset survey, this bill requires the Department of Education and the Department of Health and Hospitals to survey those students. So it almost seems as though they would have input as to what goes into the survey, but the survey is actually preset.
Well, she asked about the parents, and
No,
I think that.
No, I
yeah.
understand the parental piece, but would the state have any if the state wanted to modify the survey, or is the survey used
They
straight?
do now. They omit the sexual health questions.
Okay, so
Because
we,
by law,
and if the state
yeah.
wanted to omit, you know, if the Department of Education deemed that one question was perhaps too much or something, they could omit that one single question, or
I think
and
that's true.
and it would still.
I don't know for certain, but I think Michael Como is in the back there. But it's my appreciation that, yeah,
And who is Michael Como?
he's with DOE, the
Okay.
Department of Education.
So they would have the ability to do so. Now, once the funding is, or once we collected this data, presumably, what sort of grants would be applied for, and how would those grants be used?
Well, quite a variety of grants, as a matter of fact. There was just a round of teen pregnancy prevention grants, for example, that were applied, were all states all across the country were eligible. If in our state, in Louisiana, depending upon the type of evaluation that had to be, that was required for the grant, we may or may not have been eligible for those funding. In our case, we did a grant recently where we had to do it in the community. We couldn't do it in schools. We could have served many, many more kids in schools had we been able to do it, but the evaluation requirements did not allow us to do it in schools. So there are a number of examples.
Now, I understand the grant piece and procuring that funding, but from what Representative Smith pointed out, as far as our high levels of chlamydia, teen pregnancy, so on and so forth, I think we can pretty much assume a worst case scenario for our teens' risk. And can we not, taking that assumption, move forward assuming, move forward with that? I mean, we know where we are.
I
mean, we have the actual evidence, not evidence that's been circled on a piece of paper where you could have some reporting variations, let's say.
That's true. I think, though, it's a matter of if I'm at the Centers for Disease Control or if I'm at XYZ Foundation or agency, I'm looking at this sometimes to measure need. So I'm looking for data.
Can't they look at
across
our actual results, though, and
Yes.
see that same, and actually see it in reality?
Right, but if we, let's say that we can say in Louisiana that we've done abstinence education over the years and we want to apply for this grant, but we want to apply only for funds for abstinence. We can't prove as a result of our trends over the years, let's say we've done abstinence education for 10 years, we can't make a case that that's been effective because we don't have any trend data that would support that.
It would seem like the CDC would want us to have some additional funding, given what you're telling us. You know, it would seem like we would be high on the priority list. I just asked those, and I looked up the CDC survey on the middle school children. It does include some of those sexual behavior questions, but right now this would be limited to high school, middle school. Are they currently surveyed on this, and they eliminate that section, or do they not even receive the CDC survey?
No, we're not doing the YRBS in middle schools.
Okay.
High schools.
Okay, thank you.
And just to answer one of your questions, I've tried to do it using just the statistics that we have by looking at some comprehensive sex ed, but it never goes anywhere.
All right. We want to give the opponents an opportunity. We have a few that want to speak in opposition. While they're coming to the table, we have Dr. Will Hall and Victoria Kelly and Beth Appleton. And while they're coming to the table, I'll read the other cards in support. These are people who are in support and do not wish to speak. Ashley Politz, Louisiana AAP, Heidi Sinclair, MD, Doctors for America, Shane Riddle, LAE, Deborah Moe, LAE, Ann Stair, National Association of Social Workers, Angela Atkins, National Organization for Women, Baton Rouge Chapter, Nikita Shavers, Women with a Vision, Melanie Powers, representing herself, Jake Lansdale, Red River United, Francis Kelly, Louisiana Progress Action, Carmen Weisner, Executive Director, NASW, Marcus Fontenot, LFT, Les Landon, LFT, Sabrina Noah, Louisiana State Medical Society, Wes Hadaway, Louisiana State Medical Society, Jennifer Maruzak, Louisiana State Medical Society, Mariah Bowen, Louisiana Partnership for Children and Families, Michael Myers, Red River United, Ed Parker, AFS-CME, Sherry Jurisco, Louisiana Partnership for Children and Families, Amy Irvin, Independent Women Organization, Catherine Shurick, Now Baton Rouge, Ellie Schilling, Michelle Ehrenberg, National Council for Jewish Women, Sarah Ratcliffe, Catholics for Choice. And we have at the table now Victoria Kelly.
Yes.
And Dr. Will Hall and
Yes.
Beth Appleton, who would like to go first.
I can go first.
Okay.
Okay, my name is Victoria Kelly, and I'm actually representing myself today. I'm a resident of North Baton Rouge, which happens to be, I guess, one of the inner city communities in Baton Rouge that actually are more greatly impacted by the things that take place concerning the lack of sex education and all of the things. So I definitely appreciate Representative Smith's sentiment, and I understand it wholeheartedly, just being a part of that community. But I signed a card in opposition of this bill today for a number of reasons. The two most significant, in my opinion, is I believe that though this bill is not directly impacting sex education, and it is a sex survey addition, I do know that it is completely intrusive, and I believe that one of the things that I've seen, and just from my peers and from the people that I surround myself with, is that no matter how much the survey tends for the I guess the education of people, peers my age, it's not gonna directly prevent the issues that we're having with STDs. And I'm not here to propose any new bills or legislation, of course, but I don't think that this is the best way to go about educating our young people or informing them about how to better care for themselves when it comes to sexual education and orientation. But I did want to just quickly testify. I believe Representative Rick Edmonds asked about the questions. I do have them listed here. There are 9 questions regarding sexual behavior on the YRB. So I want to just read those questions to you just so that you'll have them in your mind. The first question is, have you ever had sexual intercourse? The second question, how old were you when you had sexual intercourse the first time? During your life, with how many people have you had sexual intercourse? During the past 3 months, with how many people did you have sexual intercourse? Did you drink alcohol or use drugs before you had sexual intercourse the last time? The last time you had sexual intercourse, did you or your partner use a condom? The last time you had sexual intercourse, what one method did you or your partner use to prevent pregnancy? During your life, with whom have you had sexual contact? And the last question is, which of the following best describes you? If that's not intrusion, and I believe it wedges a huge gap between the child and the appropriate parties that should be educating their children on sex education or sexual behavior. I believe the family is first and foremost. I believe religious affiliations, organizations, community sources are also beneficial, but I don't believe that this is a survey that should enter into this aspect of the survey rather should enter into our public. I'm also a product of public schools, and I can guarantee you that if I would have had this survey, I would have not only been extremely hesitant to, and this is not in a religious affiliation thing either for me, but it would have been something that almost would have been embarrassing, just to kind of counter something that someone else said earlier. It would have been an embarrassment because I believe that this is something I want to talk about with my mom. This is something I want to talk about with my mentor. So I think that's all I have to say. So.
Thank you, Ms. Kelly. Dr. Hall. Oh, or you want to go, Ms. Hamilton?
Beth Appleton, EBR. I'm a lawyer. I'm a parent and tax-paying citizen who can read and comprehend and who hopes that laws are written so that all citizens can understand them without having to pay a lawyer to do so. I oppose this bill, and I apologize for being redundant, but I believe the provisions included in HB 402 are illegal and violate the intent of Act 837 of 2014. I was chastised earlier for using the word illegal by Representative Broadwater, who's, I guess, not here right now, because I was not a lawyer, maybe did not understand what illegal meant. So I pulled up a definition of illegal on
Ms. Appleton, can you stick to the bill, please?
legal.com.
No, stick to the
I'm explaining what I
testimony
mean
on
by
the bill,
illegal. This
please.
has to do with, it's in my testimony. Illegal is a description for something that is in violation of statute, regulation, or ordinance. Illegal does not necessarily mean criminal. Something may be illegal under a statute that does not require criminal intent and is therefore a civil violation. The Student Data Privacy Law, Act 837, clearly states that notwithstanding any provision of the subpart or any other law to the contrary, no official or employee of a city, parish, or other local public school system shall require the collection of any of the following information unless voluntarily disclosed by the parent. This includes sexual behavior or attitudes, along with legal, there's the word again, antisocial, self-incriminating, or demeaning behavior. Act 837 does not require an opt-in or an opt-out. Act 837 requires that these questions not be asked of students in Louisiana, and that this information can only be voluntarily disclosed by a parent. The parent has to disclose the information. I'm simply asking that you uphold the current student data privacy law that so many of us parents have come to depend on. And vote no to HB 402. Thank you.
Thank you, Ms. Appleton. And again, for the record, we are vested with legislative powers, which means that we can enact laws, and the latest expression of legislative will becomes the law, just for the record. Dr.
Thank you very much. I just want to give you a little bit about background. I'm here representing the Louisiana Baptist Office of Public Policy, but I want you to know that I am a researcher. I have a Bachelor's of Science degree from the United States Naval Academy, General Engineering and Soviet Studies. I have a master's degree from George Washington University, Human and I have a master's degree in education from Harvard University in instructional and curriculum design. And my PhD is from Vanderbilt University in Leadership Policy and Organizations. I'm a retired naval aviator. I've worked at the Pentagon and the Joint Staff, and I did operational analysis there as a political and military planner on the Joint Staff. So I just want you to know that I'm approaching this from a couple of different angles, from a parent representing the Louisiana Baptists, and also from a researcher's mind and heart. Two things that Victoria did not quite elaborate to you. I'd like to read questions 69, 70 to you, so you just know how this plays into the information that, and the description of the information in the sexual survey. 69 asks, during life, with whom you've had sexual contact? I never had sexual contact. Females, males, females, and males. Number 70, which of the following best describes you? Heterosexual, gay or lesbian, bisexual, not sure. I'm not sure how this is going to help us understand the medical needs in our students. And so these are the kind of intrusive questions that are in this, included in the survey. As far as the opt-in and opt-out status, it's not a true opt-in or opt-out opportunity for parents, because parents will not see this survey and they will not know the exact questions that their children are being asked. And this is very important. I heard one person, in fact, Victoria talked about it, the biggest influence on her was talking with her mother. Research shows that 70% of teens say that the person that has the greatest influence on their sexual behavior is their parent. And we're doing something here that we know what the questions are. It's an intrusive survey. You may say that we're going to let them opt in or opt out, and they can, on their presumptive, I guess, intuition, decide that it's got this question or that question. But they're not really informed to be able to make that decision. And so we're going to drive a wedge essentially between that parent and that child, and that parent has influence. This is important because of another thing that we know about research on children and behavior, and that is regarding sexual behavior. The earlier that you introduce topics, the earlier the sexual behavior, proven by research. There may be kids in high school who are experimenting, but I will tell you there are a good number of students that aren't. And we don't need to introduce topics and answer questions that don't need to be introduced or answered before their time. And that's where the parent's role comes in. They determine that. They're seeing the behavior. They're hearing the questions. They're observing the discussions, the conversations. And we do not want to be in that process.
Sorry, you need to wrap up.
Okay. Representative Smith already told you that East Baton Rouge is number 1, Jeff Parish is number 2, Claudine is number 3, Orleans is 4, Madison, Orleans, Natchitoches. We know where the problems are with certain sexual behaviors from the outcomes. We don't need an opinion survey in order to find out that there's a problem that we need to address. And so I think it's misrepresenting the strength of this survey, what it can provide for us, other than giving special interest groups, and the 2 ladies that were up here earlier are seeking data in order to help them in their grant writing proposals. That's not the responsibility of the legislature, is to give special interest opportunity to get grants. I'll close on that.
Thank you, Dr. Hall. I was lenient with you guys on the time because I considered you the main opposition and gave you as much time as we gave the author in opening. But we also have other people who want to speak in opposition. We have Christy Cross with Education Resource Council with the Louisiana Family Forum who would like to speak, and she's also opposed. Is that all the cards and information? Okay. And then we also have Kendra Lassar with Louisiana Public Health Institute who put in a white card but would like to speak information. And before you start, I'll just say the last card we have is from Clayton Reisig with the Louisiana Public Health Institute, who is present and will provide information if requested. Go ahead, Ms. Cross.
Thank you, Madam Chairman. Brief. Christy Cross with the Education Resource Council with the Louisiana Family Forum. And I would just like to start by reiterating that a survey is not going to produce prevention. We already know there's a problem. We know that the students are taking risks. We don't need the survey to tell us that. The survey, the way it's written and the way it's administered, is not reliable anyway. It's not given in a controlled setting. It's not given, there's no scientific weight to the survey. You're giving it to high school kids anonymously to where there's no accountability for the answers that they give. We have no guarantee that they're giving the correct answers to begin with. So it's not going to allow us to target the problems that we're trying to target. The outcomes are the best evidence that we have of what we need to do. Asking the survey questions isn't going to do that. Under the statute, in the bill, under Section 2A, it tells us that sex education shall mean the dissemination of factual, biological, or pathological information that's related to the human reproduction system and may include the study of sexually transmitted disease, pregnancy, childbirth, puberty, and it goes on. To the problem right there in the information that we're going to give the students don't need to give us any more information. The bad outcomes and the risk behaviors are already there. That's the information we need. And I'll end by saying that there's no appropriate way to ask an inappropriate question. These questions they're intrusive, they're provocative, and they don't have a place in the public school system to ask our high school and middle school kids. Thank you.
Thank you, Ms. Cross. Ms. Hilferty, you have a question for Ms. Cross or is it for the author?
Might be able to answer it, or the gentleman who was just speaking, who I think left the room. Okay. Ms. Cross, perhaps you can answer this. I know that the gentleman who was just at the table brought up a concern about parents not having the ability to see this survey prior to giving their permission. if the parents were directed towards the Department of Education website where the survey were posted and given, you know, or something, would that allay your concerns as far as the parents having the ability to decide, I want my child to opt in or out of this?
I don't think that that would adequately address the issue. Of course, you've got some parents who don't have internet access, believe it or not, you know, in this day
Or
and
they
age.
could request a copy. Let's
When you're asking the parents to have to opt out of something, you're relying on them, the note making it home from school, and them actually acting on that, you know, and in their busy lives.
So this does not solve any issue for you?
I don't think that that would necessarily, and I mean, of course, I can't speak for Mr. Hall, but I think that there would be problems inherent in that as well, and that the parents have to get the information, then they have to pursue the information, and again, there's no guarantee.
And I don't think that's a huge burden on the parent. I mean, we're talking about, I would think most of these parents that would want to prevent their kid from taking the survey are already probably pretty proactive parents. So they're probably going to be the ones on the Department of Education website, look up the survey, read the survey. I will point out, too, that the child can, if anyone has any concerns about the child being embarrassed, the child can just skip those questions. The child can skip over that whole section. So the child can look like they've taken the whole survey, answer the helmet question, the seatbelt question, all forth, and just skip over this section. So they would not even have to give, and I'll say this in it as well, because I know you pointed out some concerns about the nature in which this is given. It has to be anonymous. I mean, it would be, it could be disastrous if it were not anonymous. I mean, imagine those outcomes. Yeah. So I think giving it in the anonymous setting is really the absolute best way to do this. I can't imagine any other manner of doing it. I agree, an anonymous survey, can you fudge on stuff? Of course. Nobody's going to be there. I think what they're trying to do is something we're doing in this state as it relates to sexual education is not working. You know, or we would not be number 1 and 2 on all of these lists. I think this is just striving to try to correct some of those things in a way that I do think gives parents and students choices at a few different stopping points along the way, in advance, at the time while they're actually filling out the test. I feel like, you know, we're trying to address an issue that right now we're not adequately addressing in the state.
I agree that there is an issue. I just disagree on the point that answering a question is going to move us in the direction of solving the issue. And the questions, even if there are some parents who are going to proactively come in and say, no, I don't want my child being exposed to this, we're still exposing the other children to these types of questions, and there's nothing in the bill as it's written that's going to guarantee that the child is told you don't have to answer these questions. I absolutely agree with you that anonymously would be the only way, because you're in a catch-22. If it's anonymous, it's unreliable. If it's not anonymous, you're violating the child's privacy, and that opens up a whole host of other issues, which is why it's better just not to do it.
The questioning on the CDC test, specifically in the beginning, says you don't have to fill out this questions. Mm-hmm. I mean, it does say that specifically in the instructions, that point 1, you don't have to fill out any part of it. Point 2, you can selectively skip questions as you see necessary. So I do think it gives the student that option pretty explicitly.
We still have one more person who wants to speak.
I'm good. Thanks.
So, okay, thank you, Representative Hilferty. Kendra Lassar with Louisiana Public Health Institute.
Good afternoon. I know everyone wants to get to lunch, so I'll try and keep this brief. I just wanted to speak to you as a public health professional. I've been working in public health for 10 years. I've worked at the CDC in the division that develops and analyzes the Youth Risk Behavior Survey. I've worked at a school in Louisiana that's been randomly selected to participate in the YRBS, and now I work at the Louisiana Public Health Institute, which has been contracted by the DOE in the past to write the reports for the YRBS data. So I have familiarity with the development, data collection, and reporting of the survey. And I just wanted to assure everyone that privacy and confidentiality is maintained throughout, and that the rights of parents to consent for their child to participate or not is also taken very seriously. And while we don't expect surveys to take the place of education in public health, information is important for us to understand trends over time and to be able to compare youth risk behaviors in Louisiana to the rest of the country, to other states, and within subpopulations in our state. To respect of parents having the right to review the survey, Representative Almady had asked if they can determine what questions are on it. And no, the Department of Education is given a list from the CDC, and they determine which questions from that list they will use. So they don't have to use the entire list from CDC. They can choose which ones they include. And it is general practice that parents are given the right to review that survey if they request it. So I just want to share that, and if anyone has any questions.
Thank you, Representative Edmonds, for a question.
I do. Thank you, Madam Chairman. So in developing the trends that we already know, how are you achieving that now?
So right now we can show trends of outcome. For example, we do know that over the past 12 years or so, teen pregnancy rates have decreased. But we don't know what behaviors that lead to those outcomes, how those have changed over time. So we don't know if it's decreased because students are not having sex, or if it's decreased because students are having sex but using protection. So we don't know, we can't differentiate between what behavior is leading to what outcomes. And so it makes it difficult to know what's working and what needs to be improved.
My question is how are you obtaining the data? We have lots of data. It's not a question of data.
So the data we have right now is all outcome data that's reported by medical providers, and vital statistics. So we have teen birth rates, which is provided through vital statistics. Whenever a woman gives birth, her age is reported on the birth certificate, so that's recorded. We have data on sexually transmitted infections, because that data is reported to CDC by medical providers when they have a positive test result. But we don't have data on what behaviors lead to those outcomes.
Thank you.
Okay. Thank you, members. The board is clear. Representative Smith to close on your bill. Thank you, Ms. Lasser.
Members, I hope some of this was cleared up. And I did talk to Mr. Como, and he indicated as well that for sure that the State Department of Education can look at the survey and not even ask all of the sexual questions. They can choose which ones they want and modify those questions based on their discussion with CDC. But the interesting part about this is that 42 states are doing it. And only 2 states don't ask the sexual questions, and then data shows that those states are having successes policy making in their legislatures and throughout their states in ensuring that they're setting up good policy to prevent these kinds of things from happening to our students. So and also this under the Act of 837, I think it is, it's talking about survey. This is not a required survey. It's a voluntary survey. So it's not illegal because it's not required. It's a voluntary survey that schools and parents and students can actually take. So I'm asking you to let us bring ourselves into the 21st century, because those of you who send your children to private and parochial schools, they're getting sex ed. Our kids get nothing in public schools, absolutely nothing. And that's why we have the outcomes that we do have. So I'm asking you to support the survey, and let's move forward.
Thank you, Representative Smith. Was that a motion?
Move, yes, I'm moving.
Representative Smith, before we vote on your motion, we have one more red card from Jean Mills with the Louisiana Family Forum. Representative Smith moves that we report House Bill 402 with amendments. Is there any objection? To which Representative Edmonds objects. Madam Secretary, would you call the roll, please?
Representative Almady? Votes no. Representative Bowie, Representative Broadwater? Yes. Representative Carter? Yes. Representative Edmonds? No. Representative Emerson? No. Representative Falconer? No. Representative Hall? Yes. Representative Hilferty? Yes. Representative Leger? Yes. Representative Price?
Yes. Representative Reynolds, Representative Simon, Representative Smith.
Yes.
Yes. Passes 7.
The motion passes 7-4. We were House Bill 402 with amendments.
Thank you,
members. That concludes our business today. I really appreciate everybody coming to committee prepared, and we once again finished without having to come back at adjournment. I'm sorry we only get 15 minutes for lunch, but I appreciate everybody's diligence. Representative Price moves that we adjourn. Is there any objection? Hearing none, we are adjourned. Thank you.